Thank you.
So we're going to be starting with learning outcome 4 today, which is the last one on this particular unit. And I'm just going to quickly switch over to the unit specification so that we can actually look at, the one that we are going to be discussing. So in the discussions so far on this unit, we have come to the last, which is in like particular response, looking at basically one second. All right, so we are looking at today the last learning outcome, which is primarily going to be focused on, understanding bits and pieces around, how do we work and communicate with stakeholders when you're working within multidisciplinary teams. So we've had a bit of a journey in terms of coverage for the unit, which basically includes, understanding what are multidisciplinary teams, why they're required, what kind of people work within these teams, they bring, what kind of skills they bring, experience. And specifically in the context of health and social care sector, we looked at, why is it important to work within MDTs and why this sector cannot do without, the formation of MDTs in any case. In the second one, we went on to understand, what are the strengths and weaknesses, and obviously how do leaders, managers, people in the supervisory position actually bring across and put together a multidisciplinary team which has a common understanding on goal. They are motivated and they understand that this is the larger goal that they have to achieve than looking at working individually. And then how do teams perform? So in this case, we looked at, formation of team using the Tuckman's model, if you recall, Tuckman's team building model. And we also looked at Dr. Belbin's, team roles model in terms of when teams are put together, how people look at taking up different roles and the 3 different categories of roles, which Dr. Belbin has, categorized across the 9 types, which can be seen when teams are formed. So obviously in the health and social care sector, we can get to see multidisciplinary teams and most individual taking up at least one or assuming one type of role when they work within large groups or teams to be able to deliver basically integrated care in this case. The third learning outcome was focused on understanding barriers. What could be barriers in general? What are obstacles, challenges, barriers which we face? And when we look at these barriers, what kind of barriers can crop up when we work within large teams? What could be the impact of these barriers? And then last but not the least, how do we overcome some of these barriers, which is where we looked at things like, communication, team meetings, looking at centralized decision-making, consensus building, and obviously effective leadership, which helps us overcome some of these barriers or obstacles which come across when people with lots of skills, lots of years of experience and background, different cultural background, come across and work together in a team. Now, in the last learning outcome, we are focused on how do we look at communicating with various stakeholders when you're working as a member or as a part of a multidisciplinary team. So there is quite a bit to look at in terms of the indicative content here. So first, we'll understand what are the practical issues of working within a multidisciplinary team. So these issues are going to be based around communication, time management, things like that, which could, which are basically issues that we generally get to see when we work in groups and teams. We will also look at, in the second part, what is effective communication. So it's a very big word, a very generic term, but we will look at specifically from a contextualized purpose of health and social care sector, that when we talk about effective communication, what does that stand for in a multidisciplinary team? And what are the ways through which we can do effective communication? That means communication which is transparent, clear, crisp, easily understood, without jargons. And those are the bits that we will understand, in this part. And then we will look at equal opportunities. So here, some part of it is to dip into understanding, what do we mean by equal opportunities? What do we understand by equalities and diversity? And in some cases, what we also want to do is understand some of the common issues which can come across and how organizations actually implement an equality and diversity policy or an equal opportunity policy to do away with discrimination and, meet and work with compliance in terms of legislation, the Equalities and Diversities Act of 2010, and see and develop the code of practice, which can then be followed across the organization so that nobody feels discriminated and obviously nobody feels that they have been sidelined or, their motivation levels are low, because in this sector, you generally need to have people who are motivated, enthusiastic, patient, they persevere, and they are also sympathetic to, working and understanding patient situations. And towards the end, we will look at understanding what is stakeholder management. And obviously, one of the assessment criteria 4.4 talks about how do we engage with stakeholders in multidisciplinary teams. So we'll understand who are the stakeholders first when an MDT is formed, and then how do we go about communicating with these stakeholders. So yesterday we discussed very briefly in terms of who are the stakeholders in MDT? So, or in an organization in general, it could be employees, management, directors, board, it could be the government, it could be partners and suppliers or external bodies that you work with, compliance bodies, inspection bodies, and in some cases, if you look at the financial side of it, it could be banks wherein, some organizations get overdraft facility and things like that. So they all become stakeholders in the working and running and day-to-day operations of the organization in one way or the other. So we will understand stakeholder matrix here. Who are the stakeholders within multidisciplinary teams, and how do we look at communicating with them in particular if you are a member of the team, and how do you write to somebody in the board? How do you send across information with or share information with a parent, family member of a parent, and things like that. Now, in order to get into a bit of discussion and understanding of this particular learning outcome, first, we should look at some of the key bits which are going to come across, with regards and reference to this unit. One of the key things that we will look at in this would be time and again across different assessment criteria would be that we will be looking at communication issues. So what are communication issues? How you communicate effectively? Why do we need to promote equal opportunities while providing service delivery, which is integrated care? And how do you engage with stakeholders in terms of communication? So communication is a common word across all the 4 assessment criteria, 4.1, 4.2, 4.3, and 4.4. So it is important for me just to put this into a bit of context at the start of our discussion to say that communication is going to be the key when we look at, essentially, dealing with multidisciplinary teams and stakeholders. So if we literally look at just as a definition of, dictionary definition of communication, it is basically exchanging or imparting information. So to a certain extent, when we talk about, communication as a process, we have, 3 elements in it. I don't know whether you recall or not, but communication tends to be a 3/5-step, process. So when we talk about communication, there is somebody who's going to be sending information. There is somebody who's going to be receiving information. And then when we talk about in the middle, you'll have something which is being used to process information. That means you're sending an email. So a conduit in between the sender and the receiver is primarily technology, maybe an email client or a PC. And in some cases, where we look at the, the receiver actually giving feedback or responding back to you, then in that case, you would see that feedback would become, the 4th part in the communication process. So when we look at communication in general as a process, if I just bring this across, here, just for the context of understanding, if we look at communication as a process, it is a process in which the source, which is the sender, is actually sending the message. And if you break it down further, it could be things like, the message being encoded if you're using a telephone, or if you're using a technological equipment like an email or a PC to send an email. So again, some part of the software is actually doing the encoding. The message is getting transmitted over the internet, and the channel is that internet channel. Then it gets decoded in the user's machine or on the user's end when you receive a phone call. And then that message is received by the receiver. And when the receiver actually gives you feedback or talks back and gives you response, that process would be considered as feedback. And that looping of the person receiving the message and then giving feedback to the sender would essentially communicate and complete the communication process. Now, what could be the issues that we face in this process is what we would be focused on when we discuss all the 4 ACs of this learning outcome. So things like cultural differences, which we covered yesterday, attitude in terms of conversation, that I'm a bit superior, I have more experience. It could be general, attitudinal differences which people could have. It could be sometimes when you are in a meeting and, obviously you're not very connect with what is being discussed, you might show signs of lack of motivation or engagement while being in that meeting. Listening skills are important. Communication in terms of how you write, when we briefly mentioned written communication, spoken communication, and within that you have formal, informal communication. And then looking at appropriate tools. If I'm looking at presenting today, and if I just look at a verbatim without showing you any slide, that might not be an appropriate way of communicating and discussing the LO. So in this case, my appropriate communication tool is using, a PowerPoint presentation to visually show you some bits of what I'm going to discuss, and that will engage the user, in this case, the learner at the other end, to be participative in the process of that discussion and delivery of this presentation. And sometimes we also can have issues if we have an information overload. Sometimes we use this word when we talk about information overload. And what we mean by that is you're sending too much information across, it could be essentially, sharing of data, sharing of information, which is much more than what is required. And that would basically impact the decision-making process, or maybe impact the understanding of, a particular issue by the other person. So in this case, we also can say, oversharing can also be, or if we use a particular terminology, and that terminology could be jargons, for example, that if I keep using MDTs, and I don't explain the meaning or the full form of the term MDTs, then that would create a bit of a, issue in terms of not understanding that what does MDT stand for. So multidisciplinary teams, or MDT, I need to make sure that I kind of specify that, and that tends to be resolving, or hopefully does not end up creating any communication issues. Now, outside this, there could be lots of different types of broader communication issues. But the idea here is to try and just put them into our perspective, that when we talk about how the learning outcome says, understand how to communicate with team members from disciplines and with stakeholders. So in general, what we need to do is pick out some of these practical issues that we see are going to be things which cause problems, issues, or, let's say, friction in terms of working together within a team. And these tend to be some of the practical issues that I can, look at summarizing. Now we look at them in a bit more detail. So that leads us nicely into the first assessment criteria. And they are, the first one talks about analyzing practical communication issues related to MDT, or multidisciplinary teams working. So here, some of the bits that we discussed earlier, we need to now drill them into a bit more detail and contextualize them specifically for health and social care sector. We are not going to be we are not discussing communication issues in general. We are looking at discussing communication issues which can crop up when people work in multidisciplinary teams. That means doctors, nurses, physiotherapists, healthcare workers, assistants, or practice managers. All of them come from different backgrounds. They have different roles and responsibilities, and when they work together, what kind of practical issues can come across because of lack of communication, or incomplete communication, or informal, or let's say different types of communication. But that would mean that it is not being, everybody is not singing from the same songbook. So there was a survey done by CQC. And in the survey which was done, this is something which I'm quoting from the CQC website. In this survey, what they did was they surveyed a lot of patients within a particular setup. And what the conclusion of that survey was that patients naturally feel a bit apprehensive about their health and well-being because they feel that there are numerous issues or barriers which basically, or let's say obstacles which get created when communication isn't very clear or is not consistent in terms of providing information to patients receiving care in a setup like a hospital or a care home. And some of these practical issues, which from a patient perspective were highlighted in the survey, include things like time constraints. So when nurses, we'll go into a lot of detail in this, but just very briefly, say, for example, if a doctor goes out on a round or a nurse goes out on a round, there are lots of time constraints with them because they are looking after too many patients. And in this case, what tends to happen is that they spend only a few minutes or maybe only a few minutes to basically discuss or provide information to the patient. They do not give the patient an opportunity to ask questions. There could be environmental issues if the place is noisy or there is lack of privacy. There could be things like pain and fatigue, which was specifically in the case of patients. It could be embarrassment and anxiety, again, related specifically to patients. Use of jargons, which is by the health and social care staff or the medical staff or the multidisciplinary teams which work in order to provide patient care. There was bits and pieces on values and belief, information overload, there were data protection issues, and obviously record keeping, which is different in different organizations. Now, these are some of the practical issues which are faced because of differences in communication in multidisciplinary teams. And then what I've done in the subsequent slide is I've gone into a bit more detail in terms of why these issues crop up. So when we talk about, say, multidisciplinary teams, it is very important for us to understand that some of these members which work within these teams, healthcare workers, doctors, nurses, consultants, they have varying responsibility, and their skill set is also different, is varying, because some of them have years of experience and some of them have are still in the process of developing experience. So in some cases, what tends to happen is that when we look at the information which is shared, where and the level of information which is shared, this can cause miscommunication, confusion, misunderstanding, and can actually diminish the ability of providing integrated care to be able to achieve goals. So it is very important to deal with these practical issues in communication, and that is where you see structures or operationalized structures being formed within these teams to be able to deliver effective care. So when you look at hospitals, for example, and you look at a typical hospital, and you look at a structure of the hospital, there are different teams which are working in different setups. So there is a front-end team, there is a clinical team, there is a non-clinical team, there is a nursing team, or a triage, which is a combination of nurses, healthcare workers, which basically, and a clinical nurse, which basically provide, post-operative care to patients who have undergone surgery. And these teams then work in individual silos, yet looking at delivering integrated care to the patient, because of the fact that dividing the large teams into smaller teams also does away with confusion, but it also creates clear lines of communication and helps avoid some of the practical issues which can happen because of information overload or too much information being passed on to teams which may find it irrelevant for their purposes of delivering their duties. Now, if we look at some of the issues that we discuss here, time constraint, environmental issues, all these issues that we discuss, and when we put that into context of multidisciplinary teams, we are looking at some of the issues which can arise and relate to communication can happen because of collaboration issues. That means teams are not working effectively together. There are issues in terms of working together, sharing information, and sometimes it's a case of attitudes and people from different setups and backgrounds coming together to be able to work in a team, and they lack collaboration, which can create, which obviously can create issues. Now, the reasons for lack of collaboration could be down to communication issues from the leadership, communication issues in terms of clearly defining roles and responsibilities, and that is why this point makes perfect sense when we deal with multidisciplinary teams. people coming with different backgrounds, skills, experience, and roles and responsibilities. The only way that you can wrap around and help them collaborate effectively to achieve a team goal can be done by proper channels, by setting up proper channels of communication. Then we also look at a point which is challenges. And when we look at challenges in particular, we look at challenges is because you would generally see that when people are faced with challenges, one of the key things or obstacles, issues when they come up, when people work within teams, they need to resort to communicating effectively. That means they need to be able to clearly tell what are the challenges being faced. So challenges, things like pain and fatigue. We look at stress. We look at, for example, distractions, or we look at environment in terms of, work environment is too noisy, or there are time constraints in terms of, dealing with so many patients. These are challenges which, say, for example, nurses, doctors, consultants can face within the team, and how they can be communicated in order to avoid and address them effectively. They can be done by, again, proper channels of, communication. Then we look at, sharing of useful skills. Now, the reason why we look at useful skills, and I would bring this across, is that when people work in teams and groups, they bring across, they come from different backgrounds, they bring across different experiences, they have obviously different skills. And in order to make them work in unison, that means in order for them to work effectively as a team, as a coherent team, to be able to deliver services, managers or supervisors or leaders of those teams have to then look at putting together workshops or trainings, essentially, for them to be able to make them work together. So it's like saying, if I bring together nurses, healthcare assistants, consultants, and doctors into one team to be able to deliver, say, for example, a certain type of care within a setup like a care home, what we need to do is we need to be all singing from the same songbook. That means we need to know exactly the same and use the same policies and procedures. We need to be able to understand how things work within the organization. And then we also need to understand our roles and responsibilities, and who do we depend on or go to if there is a problems, issue, or an obstacle which comes up. So people which deal with patients on a day-to-day basis, if they face problems, the first line of support is this, the second line of support is this, and then who the problem needs to be escalated if this is not being solved. So this fine-tuning of how team members work within teams and are able to effectively work can only be done by looking at understanding the skill set of the members of the team, and also then looking at doing trainings or team building exercises or some sort of activities which will enable effective communication amongst them. And this will basically mean that the members of the team can depend on each other, can communicate with them, communicate with each other freely, and they know exactly who to go on and look on to if they face an issue or if they face a problem. So some of these points that we look at are areas in which practical, let's say, communication problems or issues are faced. And these can then be solved by looking at doing team building exercises, helping to develop a team working culture. And here in in these team building exercises and some of the workshops and trainings which are conducted, the idea there is the managers or the supervisors or the management in general is trying to create an atmosphere wherein there is an acceptable standard of working amongst the various members of the team. And this would mean that they have mutual respect. They all are able to contribute in terms of voicing their opinions. There is a structure in a team to be able to resolve problems, and there is absence of personal agendas. There is nobody driving any personal agenda within these teams. And that is where policies and procedures come into place, because if they are communicated effectively and everybody understands the meaning of these policies, say, for example, equality and diversity, discrimination, look at safeguarding, some of these policies which are put into practice while teams work together and they provide services to patients within a particular setup, you would see that this can only come across if there are clear lines of communication which are set and clear channels which are available for the staff to be able to communicate with each other. Now, if we also look at some of the other some of the main issues which were listed on slide 1 when we talk about time constraints, what do we mean by time constraint? And obviously I gave a small example, is that when doctors go for a round or nurses go for a round, if they have too many patients allocated for them to be able to look into, then the time they allocate tends to be on a basis of how many patients they need to see. And sometimes this can be a constraint because the patients are not able to ask questions or to resolve their queries. And that would mean that it tends to be a one-way channel wherein the doctors, nurses, or the professionals going around for the rounds in a setup is only able to do or spend so much time with the patients, which means there are time constraints. So in some cases, if there are patients within the same bay, and if there is no way that you can actually, say, for example, segregate or separate the background noise, which could be if it's a busy clinic or if it's a busy place like A&Es tend to be, there are communication difficulties which can happen because of lots of noise in the background. And in some cases, equipment and also other things contributing to background noise and also distractions. And this can impede communication, specifically when we talk about, healthcare professionals or multidisciplinary team or somebody from the team dealing with the patient. Pain and fatigue, again, this could be sometimes patients are too stressed. There has to be an appropriate and a right time for communication in terms of understanding, when we ask generally the questions, what's the best time to have a discussion with you, or can you wait to have this discussion with the consultant? And sometimes we also look at, giving some part of this information in a written format. And a good example that I would give you here would be that if there are patients who are undergoing some sort of an operation, in the near future, things like cardiac operations or, cancer operations and things like that, normally there is a team of individuals which will be dealing with the patient, and that I would classify as a multidisciplinary team. You'll have a nurse, you'll have, say, for example, somebody who would be looking after, basically when the patient is to undergo a surgery, there will be 2 or 3 different types of teams. There'll be a team which will prepare the patient. So there are consultations which happen with the nurse, with the consultant, with the doctor, and you're given adequate information even before you undertake the procedure. So you will be maybe getting leaflets, some information about how the procedure will go through, how long will it last for you to, get better, what kind of care would be provided after the operation. So these are things which are discussed even before the operative procedure takes place. And then once you decide that you are going to go through with it, there is a team which is put in place which helps you recover. So it could be a physiotherapist, it could be a nurse, healthcare professional, doctors with regular appointments to come in and visit you, and they would then be responsible to get you back onto track in terms of after the surgery has happened. So in some cases you would see pain and fatigue tends to be the case, and that is why some of these are not rushed through. Discussion on side effects of medicines and other bits are also done in order to ensure that there is no miscommunication with regards to the side effects of any medication and things like that. Some of these points are self-explanatory. When you look at embarrassment and anxiety from a patient perspective, it could be related to sometimes when physical examinations have to be done, some patient might have cultural beliefs or they come from a background wherein some of these things might be new, and in those cases, if this is not discussed in detail even before these things have to happen, it can be a cause of embarrassment and anxiety with some patients. So that is, again, here what tends to happen is that patients and healthcare professionals tend to communicate effectively, and if the communication is not done, then it can, lead to embarrassment and anxiety at the patient's end. And that would mean that, the patient might not be very cooperative, or might dissuade, from undertaking the procedure and things like that. Then one of the key things that we look at, in this particular sector is the use of jargons. So one of the reasons why we face practical issues in communication within multidisciplinary teams is that sometimes people start to use terms or jargons which might not, which could be technical in their usage and might not mean anything to other members of the team, or in some cases they might not understand the use of these words in communication. So again, sometimes you get to hear that, can you tell me the diagnosis in plain English, or can you tell me what is the outcome going to be in plain English? So in some cases you would see that this could become a practical communication issue, because if a consultant or a doctor or a nurse starts to use a lot of acronyms or jargons, which could be technical in their nature and not easy for the patients to understand or the team members to understand, this could become a practical issue. And then there are issues in terms of values, beliefs, and assumptions, which could be from a patient's point of view, as I mentioned, information overload. And there's a good article that I would suggest that you should read in order to understand some bits in terms of practical communication issues, which is going to be up on Moodle. And the article is article basically which is labeled as Communication Skill 2: Overcoming Barriers to Effective Communication. And this is a good read because of the fact that it allows it allows you to understand in terms of what kind of practical issues come up. And this is something which has been compiled together by a team within the NHS. And it's a good read, about 10 minutes for the article, but it's a good read. Now, let's look at the second assessment criteria, which is to talk about how do we communicate effectively in a multidisciplinary team. In order to put this perspective forward, I've got a small video which I want you to watch, and then we'll do a bit of a small discussion on this to explain in terms of why is effective communication important within a multidisciplinary team. So let's listen into this particular video, which is I think about 2 odd minutes, and will give us a good perspective in terms of why effective communication is important and how does it happen within a multidisciplinary team.
The multidisciplinary model has clear added value in cancer care because treatment algorithms are not always sufficient and often do not yield absolute recommendations. Strategic decisions, especially at initial diagnosis when the treatment plan is defined, should always be taken after a multidisciplinary discussion. Communication and interpersonal relations are main challenges to effective collaboration in a multidisciplinary team. Diverse personalities, lack of trust, competition, passivity of some team members, as well as not having communication codes or behavioral standards are some of the issues we face. Overcoming these obstacles means facing individual and team challenges. As individuals, we must overcome prejudices, personal interest, and conflicts with colleagues. Every team member must refocus and remember the common objective and take responsibility for contributing their expertise. Empathy and genuine interest in others are fundamental ingredients. The entire team must strive for a common objective of identifying optimal solutions for patients. It is the team's responsibility to encourage the contribution of each member, identify useful experiences and expertise, and then follow the team's decision. Our Train the Trainer program offers participants the tools to identify the needs of a multidisciplinary team, improve its efficacy, and achieve active participation from each member.
So this gives us an idea in terms of, what we need to look at when a lot of different organizations actually look at, developing effective communication channels when dealing with or having multidisciplinary teams within a particular setup. So here, it is quite important for us to look at relating to why and how this effective communication can happen. So we've understood why communication is important and what are the practical issues. But what we need to do in this assessment criteria is to understand how can we communicate effectively when we are working as a part of an MDT or a multidisciplinary team. So here, some of the points that are important for us to understand is that when we talk about communicating effectively, we need to be looking at certain policies and procedures. So things like team policies, which are important in terms of clear lines of roles and responsibilities being defined, set of policies and procedures which are in place within an organization. They could be termed as operational policies, and these policies are then followed in order to do your day-to-day duties, and they would then help in the effective communication amongst different members who are working within the multidisciplinary teams. And these policies and protocols, if I may put it this way, can effectively help the organization achieve an optimum working setup, specifically within the health and social care sector. It is in general true for all organizations, because the reason that we have these policies, procedures, quality policies and procedures, as I would say, and then we have their implementation plan, is because these are issues, problems, obstacles that can be faced and have been faced time and again over the years. And because of which, what the organization has done is developed a process or a policy which can be invoked should this problem again arise in the future. Now, one of the second ways that we look at is when sometimes we have to communicate effectively. There are a lot of managers or people within the organization who have team leading responsibility. They always try and build consensus when they are looking at decision making, on important matters. And this consensus building amongst the members of the team is also quite important, because of the fact that when we see consensus being built, we see buy-in happening from the members of the team, and this allows everyone to focus on the central problem or the core issue, and essentially helps the organization meet that obstacle or solve that problem. So in this case, a multidisciplinary team, for example, if it is providing care to, and we looked at in the video, if a team of professionals are providing care to a patient who's receiving cancer care, then in those cases, the approach in which the care is to be provided, whether what particular line of let's say line of procedures have to be followed, or what kind of remedy in terms of some sort of care or cure which has to be offered to the patient, whether it's through medication, whether it's through surgery, whether it's through post the surgery. There is a plan which is put in place. The consensus gets forms. It's important to have that consensus with the team, so they know very clearly who's going when, who's playing what part, and how they are supporting the patient in order to, during this trying period where the patient is actually receiving cancer care. We also look at, when we talk about effective communication, the role of leadership. It is very important from a point of view of looking at making communication effective, is that people in the leadership position are able to, strike a chord with the team members, in the sense that they are able to build a relationship. They understand and they are able to make the team members understand that how the decision-making process works, what is their role and responsibility within the team, what contributions they bring to the team. And also, in general, the idea there is that they have a better understanding, or maybe because of their experience and the skills, on the, let's say, broader rollout of clinical assessments and delivery, which is required to be given when we talk about care being delivered to the patient. So here, the leaders have to take decisions or make decisions which are going to be best in the case of providing care to an individual. And the difference here between power and authority is the context which they try and make sure that the team and the members of the team understand. And this allows them to, basically bring about harmony amongst the members of the team in order to make sure that they are able to deliver integrated care to the patient. So here in this case, one of the things that I would put it this way, the leader, if there is a new process, say, for example, or a new, let's say, equipment is being brought across into the setup, then one of the things which the managers or the leaders, people in the leadership position are responsible to do is to ensure that adequate training is provided so that members of staff who are going to be looking at working on that particular equipment or using that equipment for patient care are confident, they are given that training, and then they are confident in terms of using that equipment in terms of providing the care required, for the patient. And this training as a process, as an initiative from the leadership, ensures that the staff is able to develop skills which is required to bring about to basically provide this particular care using or during the operations and let's say during the operating of this particular machine. So they need to have skills to be able to bring this working, I would say this working to be able to give care or say provide diagnosis using the equipment. So this was a specific example which I've put wherein leadership is required to take steps or initiatives in order to ensure that the inadequate training is provided to relevant team members, which will then allow them to be able to use that equipment effectively to provide care or for diagnosis. The case in point here is, if there is a new setup being introduced or a new wing being introduced in the hospital, sometimes you see expansion of setups happen, and obviously a new wing is being introduced. Say, for example, a new department is being added for mental health care, providing services on mental health care. So adequate staffing in that department, training, providing of training to the staff members of the department which are going to join and provide these services to the patient, equipment, training on equipment which would be used by the staff to be able to provide or diagnose certain conditions. That requires effective leadership, and in this case this can be done provided leadership is able to ensure that the initiatives that they are going to be carrying out are essentially helping to meet organizational goals, and these have to be communicated to the members of the team in order to ensure they have their buy-in. One of the other points which I would put it this way, when we talk about how do we communicate effectively, is also the organization looking at meeting resources and logistics needs. So when I talk about meeting organizational resources and logistics need. Now, sometimes if you're short of equipment or if you're short of resources in terms of administrative resources, physical resources, infrastructure resources, then again, the process of communication comes into place wherein, things like manuals, things like, I would say, use of stationery or, basic bits which are, if they are missing or if they are, running out, then again, in order to promote and ensure that these things are made available in time and before it actually runs out, processes have to be put in place so that they can be reordered at any, adequately before time, and they are available for the purposes of usage by, various members working within the team and the staff. So again, sometimes availability of resources and logistics issues also can communicate, also can relate, to issues that can arise out of not being able to communicate effectively. So things like, if there is like one of the things during the COVID pandemic is what we've seen is that a lot of hospitals and setups and PCC trusts actually ran out of PPE equipment. one of the things which the government battled with and wanted to effectively communicate across to various setups, nursing home, care homes, old age homes, hospitals, GP surgeries, community centers providing care, was to ensure that effective utilization of PPE could happen before the restocking was done. So when we look at Matt Hancock, at that point in time, the health secretary, then took a decision to order PPE worth £2.6 billion, which made sure that, members of staff working within, hospitals, care homes, and various other setups were not in line, were actually being shielded by using proper PPE and not being, not getting diagnosed with COVID, although some of these things did happen, and then obviously government stepped in. So again, effective communication on the availability of resources and the logistics around the providing of PPE during the pandemic was one of the key things. And that is where, again, policies, procedures, leadership, consensus, and, working together as a team is required to basically deal with these practical issues. So any questions on this so far? Okay. Now, the other bits that we want to look at in this is the third assessment criteria, which is looking at explaining how do we promote equal opportunities in service delivery when people are working within multidisciplinary teams. So here, I think what we want to do is have a quick, broad understanding of what is equality and diversity, what is the compliance and legislation on equal opportunities, and that would basically cover up our bit in terms of understanding how is this relevant to MDTs or multidisciplinary teams. So if I have to ask a question, what is equality and diversity? So equality, if we look at, it basically means that everybody in a particular setting should have equal opportunities regardless of their ability, background, or lifestyle or culture they come from. And because people within the NHS and health and social care sector, we have a lot of diversity and people come from different backgrounds. Here, what we need to be able to appreciate is that there are people with different cultures, different beliefs, different values, and we should be able to respect all of them when they come together to be able to offer their service to patients and the community in general. Now, why is equal opportunities important? It is important from a perspective that we as employers, or within the NHS as an employer, there should not be any room for any discrimination, and everybody working within the setup and within the National Health Service should be treated equally and fairly. And this is something which the NHS in particular continues to ensure that they are able to build a diverse workforce that can reflect the community that it serves. Now, when we talk about equalities and equal opportunities in service delivery, within service delivery in particular, it is important for us to understand, what do we mean by equal opportunities? So equal opportunities here would mean that, when we deliver patient care to members of the public, what we are looking at is there are no ways in which any form of discrimination tends to happen when this care is being provided. So things like when we are looking at equality, when we are looking at equal opportunities, what we are looking at is basically looking at how different community groups and voluntary organizations can work to deliver these services at the local level. How do we ensure that buildings, facilities, and services are accessible to people with disabilities? So, for example, disabled wheelchair access, which is important in job centers that we get to see, in hospitals that we get to see, parking slots being created, which are specifically marked for people with disabilities. And those are bits which mean that the setup or the organization is, providing equal opportunities. So some of these things that we see, being reflected as within the printed collateral of NHS, for example, use of different faces, to show that the NHS caters to diverse range of people living within our community. Those are bits in which what we can see is that how equal opportunities are being promoted when NHS or National Health Service or mental health service or health and social care sector is basically providing delivery. And to put this into a bit of context, why do we look at equal opportunities? Because we have the Equality Act of 2010 in the UK, and this act replaces the anti-discrimination laws, which was a single act earlier. And this act basically says that, we should be able to provide, basically provide duties when we talk about, duties being provided from within the NHS and health and social care sector, irrespective of the disability, gender, race, to the members of the public. And we should be able to we should not discriminate between, any form of race, age, gender, identity, value or belief, or, any form of discrimination should be avoided. So there are ways in which we can promote equal opportunities, and those are explained within some of these slides. There are some good, useful websites that I would say that you should look into for additional reading. And these websites would primarily, give you an idea in terms of how the National Health Service looks at providing equal opportunities when it, provides services on patient care or mental health care to the members of public in general within the UK. So this would help cover, the assessment criteria 4.3. The last one that we are looking at today is explain how do we engage with stakeholders in multidisciplinary teams. So when we look at stakeholders, let's identify who are stakeholders. Stakeholders are people who will have, some sort of vested interest. So when we talk about stakeholders, yesterday I explained the literal meaning of stakeholders is that people who have some sort of interest or concern in something, especially, for example, in day-to-day running or operations of the business. So they would be classed as stakeholders. Now, there are various types of stakeholders. These stakeholders could be, users, providers, influencers, or governance, essentially UPIG as we term them. Now, they can be of different types in different organizations, but in general, when we talk about the health and social care sector, stakeholders would be responsible. Where will you find them? One is who they are. So they could be employers, it could be the government, banks, directors, owners, practice managers, the management, I would say suppliers or partners who work, with the NHS or with the various other agencies within the NHS. They would all be stakeholders because without them, the whole operation would come to a standstill. Now, these stakeholders, what do they do? And what is their involvement in terms of, working within the setup? Their involvement is in terms of things like policy making. So when we look at inspection bodies, we look at agencies like CQC, we look at, government in terms of policy making, legislation, introduction of legislation like the NHS Act of 2010, various other legislations like Data Protection Act, Equality and Diversity Act, policy making by CQC, changes in terms of setting quality procedures. So their working as a stakeholder in this sector would be to look at policy making. That is one. Second, finances. If you look at government side, the National Health Service is a public sector. It's financed by the government. And there are lots of people working within this sector. So they are classed as public sector workers. And in this case, when we look at finances, allocation of budgets, which happen to NHS, the various trusts within the NHS, GP surgeries, community centers, things like that, which are providing some sort of care under the NHS banner, it will all require finances. Care planning, which has to be done, logistics side of things, and obviously evaluation of outcomes, which is done through, say, various agencies. So in these cases, what I would say is when we talk about stakeholders and their role, this is what we need to be able to understand very clearly, that is what we mean by stakeholders. Now, in this particular diagram, what I want to show is that there are various stakeholders within the health and social care sector, and they have a very close working relationship, which basically helps in providing these services to the members of the public. So when we talk about stakeholders, we talk about stakeholders from a point of view of the stakeholders matrix. And this is where you could basically, look at, just as an example that, how would, various people within, say, for example, a setup work when we look at this particular example of, relationship between stakeholders. Now, In general, there is a theoretical model which we term as stakeholder analysis or stakeholder matrix. And this particular, let's say the tool is actually used to determine what kind of actions are necessary to be taken in order to make sure that the goals are achieved. So when we look at classification of our stakeholders, and when we talk about, stakeholder analysis in general, when we do this, what we look at is, this is a bit of a theoretical model that we need to look at, is to try and understand that, who are the key members who are going to play what role within the setup in order to ensure that the organizational goals are achieved. So when we talk about this particular aspect of stakeholder analysis, what we tend to do is basically look at, clearly specifying the roles and responsibilities of the individual members within the team and what their contribution to the achievement of the overall objective is going to be. This is generally a project management tool, which sometimes can be used in order to look at, classification of stakeholders, and it can be used generically, across all sectors. So it's not specific to health and social care. It's a tool which is used primarily in project management. And when we talk about stakeholder analysis, we typically refer to a range of techniques or tools that help us identify and understand the needs and expectation of major players within that particular setup. So in this case, it will be the patients, it would be the staff, it will be the employees, and partners and suppliers, which are pretty much working in order to provide integrated model of care through the means of National Health Service or NHS to the members of public. Now, when we talk about the concept of stakeholder and how do we look at communicating to stakeholders, communication to various stakeholders can be done in various different ways, and this communication can be employer-led. So in most cases, when we look at multidisciplinary teams, what we are looking at is that people who are going to be key stakeholders, which are basically key responsibility holders within the organization, need to be communicated, effectively from a point of view of, providing information. So this tends to happen through the use of newsletters, emails. It happens through meetings. It happens through presentations. It happens through, summary reports which are prepared for management team in general. And in some cases, when we see closer collaboration happening, within the team on certain issues, and obviously looking at problems, there are calls, video calls or Zoom calls, as we would say, or meetings which tend to happen, and they would involve different members of the team participating in order to address or understand the issues in terms of how they can be resolved. So when we talk about communication with different stakeholders, we use various different means to be able to do that, and that would be through the use of emails. It could be face-to-face meetings, it could be video calls, it could be summary reports, presentations, it could be newsletters, and it could also be, from a strategic point of view, sometimes when you look at connecting with different stakeholders, you're also looking at, holding events or seminars, and they would be events or seminars being done in order to bring industry experts together to be able to discuss and, come to conclusions on certain ways forward on policies, procedures, changes which have to be implemented. And that would be done using, various routes of, communication at different levels with stakeholders. So the frequency at which you write, the type of communication that you do with the different members or stakeholders, in this case, I would use the word within the team, would depend on the fact that what kind of stakeholder you're writing to. If it's a board, if it's the top management of the organization, generally it tends to be formal. And if it's colleagues, peers, then you are looking at informal means of communication, things like, online meetings, emails, and face-to-face meetings. And they would help you, to engage and work with your different team members when working within a multidisciplinary team. So I hope with this, bit that we've covered, it helps you to bring a good and a better understanding of what are multidisciplinary teams and how do we look at, communicating with different members within the multidisciplinary teams, which is essentially stakeholders in MDT. And that brings us to the end of this particular discussion on Learning Outcome 4. Now, at this stage, what I would do is invite questions. If you have any questions or any doubts, I would be more than happy to, answer those questions.
Okay, Rem. Hello?
Yeah, go on.
Yeah, when should I send my questions to you?
Now,
if I'm going through again, I think that one we did yesterday and today, I've write some questions that I want to discuss with you. When can I do that?
So basically, in this case, what I would suggest you to do is you can, if you have any queries, my suggestion would be to, go through the presentation and then go through the slides in detail at your own time. And then there are sometimes, like in this case for today, I'm going to be uploading a few handouts, which are going to be article or journals that will help you go through in a bit more detail and understand with examples and applications of it, for what the topic is being discussed. And even after that, if you feel that there is things that you need to discuss or if there are queries still left, then you can definitely email us on learnerwork@ukversity.co.uk, and I will then obviously either schedule
identified it for me.
Yeah, I will either schedule another call, or in some cases, what I would do is basically send across, some additional material for you to be able to read.
All right. Thank you very much, sir.
Good stuff. So I will use this presentation and the recording of this session for today, along with 1 or 2 handouts uploaded. And then I'll catch up with you next week to discuss the assignment brief and how to start doing the assignment for this unit in order to bring this to a closure.
All right. Thank you very much.
Okay. Thank you.
All right. I'll leave it to it. Bye. Bye.
Bye.